If you look at the intensive care medicine in India in the last decade, there's a lot of change the way we practice intensive care medicine. And we have advanced equipment, and we have tele-ICU to monitor critically ill patients continuously, and we have advanced nutrition strategies for these patients and advanced rehabilitative equipment which has come to the intensive care unit, and we are able to mobilize these patients as early as possible in a better way. So when you get a patient, critically ill patient to the intensive care unit, this patient may be having one organ or multiple organ dysfunction or failure. So these patients require organ support. So whenever there is respiratory failure, when they are not able to breathe, when the oxygenation is bad, so we have seen in this COVID pandemic, the COVID is causing lung damage, and we are not able to ventilate with normal ventilators. So we have advanced ventilators, advanced modes of ventilators to improve the oxygenation of these patients. Sometimes we are not able to maintain oxygenation with these ventilators, so we go for extracorporeal membrane oxygenation. We take out the blood and oxygenate and infuse it back. So this is a new modality, and then we are using on patients with respiratory failure. And one more new modality is extracorporeal CO2 removal, and this is also very useful when there is carbon dioxide retention for these patients with lung failure. Like that, whenever the patient is having renal failure, when there is no urine output, so when the patient blood pressure is low, we have advanced type of renal replacement therapy, that is continuous renal replacement therapy. So these are newer equipments which have come into the intensive care units, and all the intensive care physicians, they are trained in how to take care of these equipment. So, and these patients require, critically ill patients require like some intervention. Sometimes you have to remove the fluid from lungs. Sometimes you have to put extra line, that is you have to put a bigger line, center line, to give drugs and fluids. So for this, we have ultrasound, and these ultrasound missions, nowadays the type of ultrasound missions we get are very small, very handy. You can carry these missions from one place to another place, and then you can attach this probe to your phone or any tablet, and then you can do ultrasound for all these critically ill patients, and then we can do ultrasound guided procedures. This has really changed the practice of intensive care medicine. And we have tele-ICU. Through tele-ICU, we can monitor critically ill patients continuously. It is difficult to have a trained, qualified intensive care physician 24/7 in the intensive care units. So these patients are monitored through tele-ICU continuously, and through tele-ICU, we are able to manage intensive care units in 2-tier cities. So these are level 1 and level 2 intensive care units. Whenever there is change in condition of the patient, when the patient becomes more sick, then we have to transfer the patient to level 3 ICU. So the tele-ICU people can advise. And we have advanced nutrition strategies. We have continuous feeding pumps to the patients, and then we have robotic equipment, rehabilitative equipment in the intensive care unit. Even though they are on ventilator, we can make them walk. We can give a good physiotherapy movement to the legs by using ergometers, and these equipment changes the way we practice intensive care in the last decade. The different people working in intensive care unit, intensive care physicians, nurses, pharmacists, nutritionists, all of them work as a team. So all these healthcare professionals, they have to update their knowledge, their skills, because we are getting new equipments, new drugs, and new nutritional products, and new beds or cots constantly into the intensive care unit. And the doctors, they are not doing any more blind procedures in intensive care unit. So they have to get trained in ultrasound, and they have to do ultrasound guided procedures. And for the nurses, so they deal with new equipment each and every day when they are managing a sick patient. The sick patient may be hooked to a lot of machines. So they should know like what alarm is coming, and they should know about this equipment, and then they have to get trained. And the nutritionists, for them, there are a lot of nutritional products available. Sometimes we give feeding through the feeding tube, or sometimes we give feeding into the blood, that is parental nutrition. and there are different access to give feeding and what type of feeding to give, and then what type of nutritional products are available, and then they should get trained regularly. And for the physiotherapists, so they have robotic equipment which is available to take care of these sick patients in intensive care. Sometimes when the patient is on ventilator, you need to mobilize him. So we need to give good movement to the lower limb. Sometimes we have to make him stand, we have to make him walk. For that, we have good robotic equipment available, and then they should get regular training about this equipment. This Medvarsity masterclass, and the way they prepared these classes, or anybody can understand. They are very simple, and any doctor can understand, and it is easy to practice. See, sometimes you are not an intensive care physician, but still you are taking care of level 1 and level 2 intensive care unit in our hospital, which may not be in the city. It is in a 2-tier city, or it may be in the rural area. So you want to have basic knowledge about intensive care, so you can attend these classes, and then you can update knowledge about the intensive care, and you can take care of level 1 and level 2 patients, intensive care patients. And when the patient becomes critically ill, when it becomes level 3, we can always transfer the patient to a advanced critical care unit. A lot of doctors, they're interested in doing critical care medicine fellowship because there are a lot of job opportunities in critical care medicine. If you look at any hospital nowadays, yeah, they are increasing critical care beds in any hospital. Previously, we used to have around 15% dedicated to critical care, but now that ratio has changed. Now some hospitals, they have 30% critical care beds. Sometimes some new hospitals, they have 40% critical care beds. In one survey, they found there are in future there are going to be only 5 to 10% of normal beds, and rest of the beds are critical care beds. So definitely there is a lot of opportunities for critical care. When you are certified after attending these masterclass in critical care medicine by Medvarsity, your specialty may be different. You may be a surgeon, or you may be a physician who is taking care of ICU. So after this certification, you will have better knowledge, and you will have even better job opportunities to work in level 1 and level 2 critical care units. So if you do these master classes regularly in critical care, and you may attend these advanced critical care fellowships, and you can clear the exams easily, and you may work in level 3 critical care units also.